Hello everyone, this is Catherine Ardo of BSN3B again, and today we are at episode 3 out of 4 of this podcast series. And in today's episode, we will be talking about urinary tract infections. So these are infections in maybe any part of the urinary system, and is often caused by the microorganism E. coli. So for UTI, we can usually think of it as an invasion of said bacteria. So what we do with them is we kill them usually through antibiotics and we flush them out with some fluids. The urinary tract infections are usually managed through the mnemonic ABC of care, starting off with A for antibiotics, which are the primary treatment for this infection. Here we have nitrofurantoid for the bladder and ciprofloxacin or cefotaxone for cases such as pyelonephritis or kidney infection. So the next letter in mnemonic is B for behavioral changes. These are the key interventions as habits like wiping front to back and urinating after sexual activity can help lessen the chances of getting an urinary tract infection. The last letter is C for careful hydration as well as pain control. And for recurrent urinary tract infections, we have another acronym called P. So P for prevention. So we must do this by increasing our fluid intake. The first P is excretion. So we have to urinate after activities such as intercourse. And the second E is to eliminate. So here we can eliminate irritants by avoiding unnecessary invasive procedures such as catheters. The key is getting the right drug for the right amount of time, especially for those patients who have serious kidney infections such as pyelonephritis, which can also cause fever and flank pain. So for patients who have catheters while they are admitted in the ward, we must also take note of the different types of catheters and their uses. We have single prong, double prong, and triple prong. So for this one, we need to learn more about their types of situations where they are used and also the types of care that we nurses and other professionals need to do for them. So an important one for catheter care is taking note of the changing frequencies. So we need to take note of when the catheter is administered and when we should change it to another one. This is to provide safety and prevention for urinary tract infections. As a student nurse, I've seen a lot of patients with different types of catheters in the wards that I've already been exposed in. Although these management for this podcast is shorter compared to the other episodes we've already discussed, I think that urinary tract infections are as equally as important as the other disorders. So now we've come to this part of the podcast where a nursing scenario is given and we will talk about the interventions and management for this person. So here we can say a 30-year-old female presents with dysuria and urgency. She also shows signs of uncomplicated cystitis. So the nursing interventions are two. So here we have prioritizing the patient's comfort as well as prioritizing the cure for her actual infection. So in here, nurses can administer medications for pain relief such as NSAIDs, and we can also administer the doctor's ordered maybe short course antibiotics for the patient's cystitis. These include trimethoprim sulfamethoxazole or nitrofurantoin for 5 to 7 days. These medications give immediate pain relief for the patient, so it would improve their comfort, and as well as the antibiotics can also be effective to minimize the antibiotic resistance of the patient. That is to note that these nursing interventions are dependent, so we must work closely with the physician to ensure that all medications are given with the right patient, the right dose, the right route, and the right frequency. And that ends our shorter podcast episode for the management of urinary tract infections. And although the management for this one is usually through medications and prevention for the said disease, it is also important to note that we need to do them meticulously and we need to ensure that every detail is correct because UTI can also sometimes lead into dangerous complications, especially for those people who are pregnant. So once again, this is Catherine Arda of BSN3B, and I will see you all in the last episode for our podcast series. Bye bye!